Thank you very much for having me and allowing me to speak today. It's been a very insightful 2 days of interaction. I think today we've talked a lot about advanced therapeutics as well as getting things right. One of the things that we want to talk about is just about how the idea of making sure that we're still capable of doing these therapeutic procedures quite comfortably, because that's quite an important part of the endoscopy procedure as well. And so we'll talk a little bit about ergonomics within endoscopy, as well as some factors that take place. And I know we touched upon this over the last couple of days, but 89% of GI endoscopists face some sort of MSK work-related injuries as a result of doing endoscopy. And there are a number of factors to this, but one of the main things is looking at your endoscopic room, the technology that you're using, and the ability to use that technology in the correct manner. As you'll start to see within endoscopy, you'll see more and more bigger screens that come into the endoscopic room. And it's important that those sort of things are countered with the correct positioning of those monitors. The bigger the screen, the further away you need to you need to visualize. The positioning of that patient is very important as well to enable you to do further therapy comfortably, as well as the way that the processor behind you is sat in the endoscopic room. The data currently suggests that the number of female trainees is increasing in gastroenterology. We have around 20% of the workforce is currently female, and that's a growing number, which also means that the hand size and grip strength is changing from a larger hand size to a smaller hand size, but the grip strength is also as important. One of the notable facts is women generally start to feel a lot of pain over 5 years of endoscopic procedures. So as they're coming into the field, within the first 5 years, there's a growing increase in musculoskeletal injury. That's compared to a 7-year injury rate within men. So they experience the injury a lot earlier. So it's important that endoscopy companies like ourselves were able to develop tools for you in order to really improve the ergonomics around endoscopy. And so we've done that with some of our latest range, and what you'll notice over the time of using your first endoscope to the endoscopes you use towards the later end of your career, they will evolve and they will change in terms of the way that you're able to hold them, handle them. They'll become lighter, the angulation will become more controlled. You'll have a variable stiffness in terms of colonoscopy, but also in order to help you maneuver to the cecum and then and come into a more comfortable procedure, not only for yourself, but for that patient as well. We do that through a number of ways. So our R&D team are constantly evaluating, measuring hand sizes, the way that people grip things, where they grip them, what angles they hold. So all of these factors are part of our R&D process. And over the time of our development phase, we engage clinicians as yourselves in order to try prototypes where we can start to mold or define the future of endoscopic tools. And sometimes the smallest changes can make the biggest difference. Some of the small changes that we do, there was a video showed yesterday, but the way that the control body sits in your hand, just a 2 millimeter change in weight distribution results in a much more ergonomic feel and a lighter endoscope in your hands. Although the weight might not change, the weight distribution does, and therefore feels a lot more comfortable. The same with control wheels, the way that they're designed, they're aimed to incorporate more and more of a ergonomic feel so that you feel less strain on your hands, which means you're able to do a more comfortable procedure and more patients at the end of the day. Visual technology has also changed, so we moved from standard definition to high definition and onwards over time. And we now have upscaling to 4K technology, which hopefully ensures that you're able to visualize lesions better, resulting in less eye strain for yourselves as well. One of the most notable things is we introduced a control wheel. I know somebody mentioned that yesterday in one of the lectures. We introduced a control wheel, especially for the right-left wheel for endoscopes, where you're able to less strain on the thumb therefore allowing you to avoid the two-hand operation and allowing a bit better control during endoscopy, especially the therapeutic procedures that we're all more likely to do in the future. Those are all incorporated in our latest platform. So not only do we have the endoscope, we also look around in the endoscopic room and look at ways of improving the ergonomics for the room. So it's not just about the endoscopist, it's also about the nursing staff, the support staff in the room as well, making the system a lot easier to set up, quicker to use, as well as creating individual unique preferences for your systems as well. So I didn't want to take up too much of your time, so I think I'll just leave you with a video from a doctor in the UK who has, if I can play it, I will, who really talks around how the new series from Pentax has changed her endoscopic practice in colorectal cancer. Can we get sound? What's the sound? Ah, perfect.
I'm Annabelle.
I'll just restart that. Thank you.
More patients are being diagnosed with colorectal cancer at an earlier stage as a result of engagement with a bowel cancer screening program. I'm Annabelle Shaw. I'm a colorectal and general surgical consultant, and I work at Croydon University Hospital. Bowel cancer often doesn't present with symptoms. When people do present with symptoms, they often complain of a change in bowel habits, so either a tendency to looser stools or constipation. The main symptom that people often recognise is rectal bleeding. Sometimes people have weight loss or abdominal pain. Sometimes they don't have any symptoms at all. We run the bowel cancer screening program, and it is there that we pick up a lot of asymptomatic patients. Bowel cancer is normally picked up via colonoscopy. Sometimes if patients aren't fit enough in the first instance, they can have other tests such as CT colonoscopy or CT scans. As part of investigations, if a patient is anemic as the only symptom, then they will often have an OGD or gastroscopy as part of that investigation as well. But ultimately a colonoscopy is required in order to confirm a colorectal cancer, and we use Pentax colonoscopes here at Croydon University Hospital. Having had the opportunity to trial the I20C scope, I have noticed a significant improvement in the quality of the scope experience. The views that we get are significantly improved. The handling and the ergonomics of the scope is night and day when compared to the older generations. The scope is much lighter weight, which means that it is much easier to manoeuvre. The I20C has the variable stiffness, which is a very helpful adjunct in improving the manoeuvrability and handling of the scope. As a forward-thinking endoscopy department, we are always keen to work with innovators or designers to improve the product that we use. Ultimately, improving the technology and improving the equipment means that we can provide better care for patients.
So I really hope that kind of summarizes the technological advancements that we're trying to do, especially in terms of improving the care for patients as well as endoscopists. I think that's a growing concern within the endoscopic community now anyway, is ergonomics, how we're going to improve the procedures are getting lengthier, they're getting more and more complex, and how we develop different things, I think, is really a two-way interaction between yourselves and industry like us, so that we're able to really move forward and drive innovation into your hands. So thank you very much for taking the time to listen. Appreciate your time. Thank you.